Warfarin is a drug that's been around for over 50 years and is used to prevent clotting in patients who are at risk of forming potentially life-threatening blood clots. It's a difficult drug to find the right dose in. Many patients require different doses, and trying to find the right dose for the right patient is a great challenge. If you give too much of the drug, you run the risk of bleeding, and if you give too little of the drug, it doesn't work. The COAG trial was a study sponsored by the National Institutes of Health, particularly the National Heart, Lung, and Blood Institute. And it was designed to specifically test whether genetic information on top of what we know already about patients can provide benefit in selecting the right dose for patients beginning warfarin therapy. The trial demonstrated that the use of genetic information did not provide any additional benefit above and beyond what we can normally do with basic clinical information among patients beginning warfarin. In addition, there was a suggestion that in African Americans, clinical-based dosing was in fact better than dosing that added in genetic information. The COAG trial really demonstrates how important it is to do formal clinical trial testing in a rigorous fashion in order to really understand whether or not we should use genetics for dosing our patients or selecting drugs for those patients, particularly in complex situations such as warfarin.